So pain measurement scales are valuable tools in sports therapy and rehabilitation for assessing the intensity, duration, and nature of a patient's pain. However, there are both advantages and limitations to their use. So we're going to look at the pros and cons of using pain measurement scales in this setting. So let's start off by looking at the pros of using pain measurement scales. They're simple and quick to use. So pain scales like the Visual Analogue Scale, also known as VAS, or the Numerical Rating Scale known as NRS, are straightforward, quick, and easy to use. They require minimal training for the therapist, and they're not time-consuming for the patient, making them perfect for busy clinical settings. Now, they're quantifiable and objective at the time, so these scales provide quantifiable data that can be documented and tracked over time, making it easier to evaluate the effectiveness of the intervention. Now, having kind of numeric values for pain helps with communication amongst healthcare providers, and it supports consistent patient records. Now, patient engagement. Using pain scales can help patients reflect on their pain and be more involved in their rehabilitation. It encourages them to think about how pain changes over time, which can improve self-awareness and engagement in their treatment. You can use it to monitor how effective treatment is. So pain scales are useful for monitoring a patient's response to treatments and can indicate whether an intervention is reducing pain. Now, this can help therapists make informed decisions about adjusting or continuing with treatment. Now, universal use. So pain scales like the FACE pain scales are accessible for a wide range of patients, including those who may have difficulty with verbal expressions, such as children or non-native speakers. So let's talk about the cons of using pain measurement scales. Now, they're very subjective. Pain is a highly subjective experience, and one person's rating of 5 on a pain scale might mean something completely different to another person. There are cultural differences, emotions, and individual pain thresholds all influence how pain is perceived and reported, which makes consistency a challenge. Limited context. So pain scales provide a single number to represent a complex experience, without context regarding the nature, location, or triggers of pain. They don't offer insight into how pain affects daily activities or emotional well-being, which can be important in understanding a patient's overall condition. You also get the risk of miscommunication. So some patients might misunderstand the scale or be unsure about how to rate their pain. For an example, a 0 to 10 scale might be confusing if patients don't understand what the endpoints kind of clearly represent, and this can lead to inconsistent or inaccurate reporting of pain levels. Now, these focus solely on pain intensity. So pain scales often focus only on pain intensity, ignoring other factors like pain duration, type, so sharp, dull, burning, or impact on function. Now, in sports therapy, knowing how pain affects movements and function is crucial, and pain intensity alone may not reflect the full impact on an athlete's performance. Dependency. So relying heavily on pain scales can make both parties, so the patient and the therapist, overall focused on pain as a metric for recovery. Improvement might occur in mobility, strength, and overall function, even if pain levels are slow to change. Now, this can lead to a sense of frustration or demotivation if pain scores don't improve as expected, despite real progress in other aspects of rehabilitation. Now, pain measurement scales are beneficial tools in sports therapy and rehabilitation for providing a quick, quantifiable measure of pain and tracking changes over time. However, they are subjective and lack depth, meaning they should be used alongside other assessments to gain a more comprehensive understanding of a patient's condition. Now, balancing the use of pain scales with evaluations of function, range of motion, and psychological well-being provides a more holistic approach to patient care.